Hello guys, this is Dr. Possibility from Excel Academy. Kindly make sure that you subscribe to our YouTube channel and make sure that you register with Excel Academy. In this tutorial, I am focused on my part 3 of birth defect. Please make sure that you watch part 1 and part 2. Let's quickly get started. The first question is, name the condition shown. So if you look at this condition, you are going to observe that there is the absence of the word of the long bones. As a result, this condition is known as meromelia. What causes this condition? So this condition is due to the use of a drug which is called thalidomide during pregnancy. Let's quickly move on and look on the next question. The next question is, name the condition shown. So if you look at this condition, there is the incomplete fusion of the urethral folds. And this fusion, this opening, is taking place below the penis. As a result, this condition can be known as the distal or proximal hypospadias. What causes this condition? So this condition is caused by the fusion of the urethral fold, which is incomplete. 2. This condition can be caused due to the abnormal openings of the urethra occur along the inferior aspect of the penis, and this usually happens near the glands along the shaft or near the base of the penis. Let's quickly move on and look at the next condition. Name the condition shown. So if you look at the condition, you need to look at the part which is being affected. And this part which is being affected, it is the abdomen region. And in this case, you need to look at the covering whereby we have the presence of the amnion cavity, which is covering the visceral organs. As a result, this condition is known as the ophalocells. So one of the difference between gastrocitis and ophalocells is that in ophalocell there is the presence of the amniotic cavity. Then what causes this condition? So this condition is due to the failure of the intestinal loop to return to the cavity after a physiological herniation. Let's quickly move on and look at the next question. The next question is, name the condition shown. So if you look at this condition you can observe some intestines which are outside and there is no amniotic cavity. In that case, this condition is known as gastroschisis. What causes this condition? This condition is caused due to the loop of bowel which extends the closure defect in the vertebral body. The other cause of this condition is the exposure of a pregnant mother to chemicals. Let's quickly move on and look at the next slide. The next slide is, name the condition shown. So if you look at this condition, you need to observe that this child has a lot of keratin. As a result, this condition is known as ichthyosis. And then what causes this condition is that 1, there is a gene mutation. 2, there is also change of the process of keratination, which leads to the overproduction of keratin. So ladies and gentlemen, let's quickly look at the next question. Name the condition shown. So if you look at this condition, you can easily look at the shape of the head, and this condition is known as the clover leaf scar deformity. And this condition is caused due to the early closure of the sutures of the scar. So what causes this condition? This condition happens when the several joints, which are the sutures between a baby scar bone, begin to fuse too early. So ladies and gentlemen, thank you very much for joining me. This was Dr. Possibility from Excel Academy. Please make sure that you subscribe to our YouTube channel.